Hi everyone, Dr. David Cully here with Synergy Wellness in New York City to discuss spinal fusion. Okay, so a lot of you are either considering spinal fusion or maybe you've already had spinal fusion. And if you had spinal fusion, I'm going to assume that you had really severe back pain and maybe probably leg pain, because if you don't have leg pain, typically they don't do surgery. We're going to talk about people that have had spinal fusion or are considering spinal fusion, and what are your options? There's not a lot of options, and all the other options you have probably exhausted. You've done the injections, you've done the medications, the muscle relaxers, the anti-inflammatories, maybe the heavier narcotics and pain relievers. And I want to show you guys a technique that I have been certified in for several years now. And we have Denise here who has a spinal fusion. Denise had her spine fused several years ago, right?
Yes.
How many years ago now?
15.
15 years ago, and she came in to me. She was referred to me by another patient that did not have a spinal fusion, but regardless, most of you that have had a spinal fusion, you think, well, oh my God, a chiropractor? Are you kidding me? No way. I get it, right? And your doctor, your surgeon, your medical doctor, your PCP, your internist probably tells you the same. The problem is they don't know chiropractic. They've never even taken a class. They've never even mentioned it in medical school. So they know nothing about chiropractic. They just know or think we crack bones, and they don't really know. Maybe we take pressure off nerves. They don't know much more than what you know, okay? Which is sad and pathetic, but it's the truth. So there is a technique called Cox flexion distraction technique, and Dr. James Cox's father was an osteopath, and Dr. Cox just passed away this past year, and he left us his legacy, this technique, which is just an amazing technique backed by tons of science out of Indiana University. Go ahead and check out the website, Cox flexion or Cox technique, and the end of technique is spelled not with a Q-U-E but a TECHNIC.com. So www.coxtechnique.com. Now, that being said, this is the gold standard when you're dealing with disc herniations, spinal stenosis in the neck or the lower back, disc bulges, pinched nerves in the spine, and yes, pre-surgical cases and post-surgical cases. And I think Denise will let you know what her experience is. When she first saw me, she had sciatica. Right?
Yeah, absolutely. I was in so much pain, it was absolutely not bearable.
Yeah. And she's got no sciatica now, and she sees me periodically for checkups, and she's leaving for a trip coming up here, and we want to make sure she's all tuned up before her trip and there are no issues. So I just did some cold laser therapy over the spinal, the surgical area, and above and below it, and follow that sciatic nerve path. When she's got really bad sciatica, we'll put the laser down here along the leg, along the path of the sciatic nerve. But she does not have sciatica, as I said. So we just lasered, and then we loosen up the soft tissue here around the spine, and then we begin the flexion distraction technique. And I'll show you guys what that looks like. So we strapped her in. She's already been tolerance tested. We've done this technique on her many times. And we want to make sure that we place our hand above where the fusion was. She had a L4, L5 fusion surgery, as we said, 15 years ago. And this is a really gentle technique that can be used for anybody with spinal stenosis, disc bulge, disc herniation, sciatica, or spondylolisthesis, spinal fusion, even if it's more than one segment that's fused. And if you're considering getting spinal surgery, you should definitely consider doing this technique at the recommended allotment by your doctor, and give it 6 weeks. You should see a minimum of 50% improvement in 5 weeks. That extra week is just a little icing on the cake. Give it 6 weeks opportunity. I'm not saying it's going to resolve completely in 6 weeks, but you should see at least 50% in that time. And again, if you guys have any questions or are looking for a Cox Technique doctor, you could go to their website, coxtechnic.com. Those are the doctors that have recently updated their testing and everything. So there are a lot of doctors out there that are certified in the technique that may not be on that website, me included. I haven't been, recertified in the last few years. So, though that may be why you don't find a certified doctor on the website, but you could certainly call around and ask if the doctor is certified. This hands down is the gold standard if you've had spinal surgery or are considering spinal surgery, any kind of spinal surgery. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.